Hello, everyone. A warm welcome to all of you tuning in today. I am Dr. Amy. As the leaves change and the days grow shorter, many of us begin to feel a shift in our mood. This isn't just the typical winter blues, but it could be a more serious condition known as seasonal affective disorder, or SAD. It's a type of depression that's related to changes in seasons, usually starting in fall and continuing through winter, affecting our mood, energy levels, and daily routines. Today, we're diving deep into this topic, shedding light on what SAD is, who's at risk, how it's diagnosed and treated, and most importantly, providing you with practical tips to manage this form of seasonal depression. Our aim is to equip you with knowledge and strategies to better understand and cope with SAD. Stick around to learn more about this often overlooked form of depression.
Seasonal affective disorder, or SAD, is a type of depression that's related to changes in seasons. Just like the leaves on trees, our moods can also change with the seasons. This condition typically kicks off in the fall and lingers through the winter, leaving individuals feeling drained and moody. Now let's talk symptoms. People with SAD may experience low energy, moodiness, and disruptions in their sleep patterns. They may also notice changes in their appetite or weight, feeling either lethargic or agitated, having difficulty concentrating, and losing interest in activities they once found pleasurable. These symptoms can be quite disruptive, affecting every facet of life from work to relationships. But what causes these seasonal mood changes? Well, there are a few theories. One is that the reduced level of sunlight in fall and winter may disrupt your body's internal clock, leading to feelings of depression. Another is that the change in season can mess with the balance of the body's level of serotonin, a neurotransmitter that affects mood. And let's not forget melatonin, which plays a role in sleep patterns and mood. When the balance of these chemicals is off, it can trigger a case of SAD. But here's the kicker. You don't have to hibernate all winter to experience SAD. Even people living near the equator, where there is no drastic shift in daylight hours, can experience this disorder. This suggests that more than just light exposure is at play. Factors such as genetics, age, and your body's chemical makeup can also contribute to developing SAD. In essence, SAD is more than just the winter blues or a seasonal funk that you have to tough out on your own. It's a real and serious condition that can have a significant impact on your quality of life. Understanding these symptoms and causes is the first step towards managing SAD. Remember, it's okay to reach out and seek help if you're feeling down. You're not alone, and there are many resources and treatments available to help manage this condition. Let's talk about who's most at risk of developing seasonal affective disorder. Certain factors can increase your likelihood of experiencing SAD. For instance, women are diagnosed with SAD more often than men. Also, living far from the equator where winter daylight hours are very short can contribute. A family history of depression or SAD heightens the risk as well. And if you're already dealing with depression or bipolar disorder, you may find that your symptoms worsen with the seasons. However, it's essential to understand that these risk factors don't determine who will get SAD. This disorder can affect absolutely anyone, regardless of gender, location, family history, or existing mental health conditions. It's not about ticking boxes on a checklist. It's about being aware of changes in your mood and energy levels as the seasons shift. Remember, anyone can experience SAD, so it's important to pay attention to how you're feeling as the seasons change. If you think you may have SAD, what's the next step? This is a crucial question. The first step towards diagnosis is recognizing the symptoms we've talked about earlier. If these symptoms are familiar, it is best to consult with a healthcare provider. They will conduct a thorough evaluation to rule out other possible causes of these symptoms, such as thyroid issues or other forms of depression. Seasonal affective disorder is not just a case of the winter blues and should not be taken lightly. Proper diagnosis is key and often involves detailed discussions about your medical history, your mood, sleep patterns, dietary habits, and how you've been coping with day-to-day activities. Once diagnosed, a variety of treatment options are available. Light therapy or phototherapy is a common method. This involves exposure to a special type of light that mimics natural outdoor light, aiming to influence brain chemicals linked to mood. It's been proven effective, especially when combined with other forms of treatment. Medication is another option. Antidepressants can be prescribed, particularly ones that increase serotonin levels, a brain chemical that dips when you have seasonal affective disorder. Your healthcare provider will guide you on the correct use of these medications. Psychotherapy or talk therapy is also beneficial. Cognitive behavioral therapy specifically tailored for SAD can help you identify negative thoughts and replace them with more positive ones. It also helps you develop coping strategies to manage your symptoms. In certain cases, vitamin D supplementation may be recommended. Research on its effectiveness is ongoing, but it could be a beneficial addition to your treatment plan. Alongside these treatments, lifestyle changes are often encouraged. Make your environment sunnier and brighter. Open your blinds, sit closer to bright windows, and spend more time outdoors. Regular exercise also helps. It has a positive impact on your mood and energy levels, and can also improve your sleep. Remember, taking action is fundamental. The sooner you start treatment, the more effective it's likely to be. With the right approach, it's entirely possible to manage SAD and lead a healthy, happy life. So, what can you do to manage symptoms of SAD? Let's delve into some practical tips that could help. First off, light therapy or phototherapy. This involves sitting a few feet from a special light therapy box for about 20 to 30 minutes each day. This box emits a bright light that mimics natural outdoor light, which can significantly help alleviate symptoms of SAD. The best time to use it is typically in the morning, so you can start your day on a bright note, literally and figuratively. Next, let's talk about staying active. Regular physical activity can boost your mood and energy levels, helping to combat the lethargy often associated with SAD. Whether you prefer a brisk walk in the park, a yoga session, or a high-intensity workout, the important thing is to get your body moving. And if you can do it outside and soak up some natural sunlight, even better. Social support is another crucial aspect of managing SAD. It's easy to isolate yourself when you're feeling down, but connecting with loved ones can provide much-needed emotional support. So, reach out to friends or family members, join a support group, or even volunteer in your community. Remember, you don't have to face this alone. Establishing a routine, particularly for your sleep and wake times, can also help regulate your body's internal clock. Try to go to bed and wake up at the same time every day, even on weekends. This consistency can improve your sleep quality and mood. Lastly, but certainly not least, don't hesitate to seek professional help if your symptoms are severe or if these self-help strategies aren't enough. Mental health professionals, such as psychologists or psychiatrists, can provide effective treatments and coping strategies tailored to your specific situation. You might also want to consider consulting with your healthcare provider about medication options. Remember, it's okay to ask for help, whether from your loved ones or a mental health professional. Let's quickly recap what we've discussed today. Seasonal affective disorder, or SAD, is a type of depression that comes and goes with the seasons. It often starts in the fall and continues through the winter, bringing about symptoms that can disrupt our daily lives. Anyone can be affected by SAD, but it's more common in females, those living far from the equator, and individuals with a family history of depression or bipolar disorder. The good news is, SAD is manageable. Light therapy, medication, psychotherapy, vitamin D supplementation, and lifestyle changes can all help alleviate symptoms. It's crucial to stay active, connect with others, establish a routine, and if necessary, seek professional help. Remember, you're not alone in this. There are resources and strategies available to help you manage SAD, and while the winter months may be challenging, they're also temporary. Thank you for tuning in today, and don't forget to like, subscribe, and share your thoughts in the comments below. Until next time, take care.
Thank you for watching today's video on mental health with Dr. Amy. If you found our content helpful, please consider taking a moment to support our channel. Here's how you can help. Subscribe to our channel. Click the subscribe button below. This way, you won't miss out on our weekly videos designed to help you with your mental health journey. Like this video, if you enjoyed what you watched, please give us a thumbs up. It helps more people find our content and supports our mission to spread mental health awareness. Leave a comment. We love hearing from you. Share your thoughts, experiences, or any questions you might have in the comments section. Your feedback is invaluable to us and helps shape our future content. Share on social media. Help us reach more people by sharing this video on your social media platforms. Every share makes a big difference in building a supportive community around mental health. Remember, you're not alone on this journey. Together, we can make a difference. For more tips, strategies, and discussions on mental health, stay tuned to Mental Health with Dr. Amy. Until next time, take care of yourself and each other.